wa- I warmly welcome you all to this session of Indian Psychiatric Society, Tamil Nadu Chapter, RCBC, Statewide Journal Club and Lecture Series. And a special welcome to all the postgraduates, faculties, RCBC members, the state office bearers. And I also extend my greeting to the today's presenter and distinguished guest speaker and author, Dr. K. Raman sir. This platform is an excellent opportunity for the postgraduates to dwell into the world of research. It is a space where you are encouraged to ask questions freely. You can engage in meaningful discussions, and you can get clarified without hesitation. Learning here is an interactive and it is inclusive also. And a few things before going to the today's presentation. Today is actually World Schizophrenia Day. Many of us know. It's a dedicated day to raising the awareness, reducing stigma, and promoting kindness towards the individuals living with schizophrenia. And this year, the theme was celebrating the power of community kindness. Reminds us how crucial the empathy and inclusions are in the psychiatric care. And to a personal note, and I'm happy to share that one of my research papers was published last night in the journal Schizophrenia Research, which titled Comparison of Auditory Brainstem Response, Finding in Drug-Naive Schizophrenia Patients with Healthy Comparison Subject. And I would like to take a moment to acknowledge Dr. Raman sir. I had a privilege of attending his class during my All India postgraduate preparation at Speed Medical Institute in 2008 and 9. His way of teaching psychiatry was unique. He instilled in us that the belief that psychiatry is not that much complex, but actually simple and logical when understood properly. His engaging style and comprehensive coverage left a lasting impact. I still have his notes. It's a true pleasure to have him with us. With that, let us all look forward to an enriching and insightful afternoon. Now I invite Dr. Shivanand sir to formally introduce our speaker and to start the session.
Yeah, thank you, Vandal. Thank you, Dr. Shankar. And you already introduced the guest speaker very well. It is a formality to do this. It is my honor to introduce Professor Dr. K. Raman, psychiatrist cum researcher. After his MD psychiatry, he has specialized in child and adolescent psychiatry from CMC Vellore. Currently, he is working as a professor of psychiatry at Saveetha Medical College and Hospital, Chennai. As Dr. Shankar already told, the Tamil Nadu chapter of IPS conducts this journal club statewide for postgraduate students of Tamil Nadu and Puducherry. But however, it is attended by many senior psychiatrists, private psychiatrists, and faculty psychiatrists. We are fortunate to have them as audience and also expert commenters. The article chosen, we choose one of the guest speaker for every month for this journal club conducted on 3rd and 4th of Saturday afternoon. And the article chosen for this today published from Dr. K. Raman is developmental regression in children with autism based on parent reports, a cross-section study from Eastern India, published in 2020 in the prestigious Journal of Indian Association of Child and Adolescent Mental Health. This is the only journal which is available for children and adolescent mental health in India.
Now we move on to the next session, guest lecture. It's a pleasure to invite Dr. K. Raman sir, Professor of Psychiatry, and the topic on regression in autism spectrum disorder. Over to you, sir.
Sure. Thank you, Dr. Shankar, and it was a pleasure knowing that your article is published today on World Schizophrenia Day. Keep up, and that is nice on the research meeting day also. At the outset, I would really like to thank TNIPS and Dr. Shivanand sir and for introducing me and for this opportunity. Of course, as a teacher, it's always I always have this tendency that I have a lot to learn and I'm just stepping up the ladder. So just because it's a postgraduate driven program, I just want to give a small piece of advice to postgraduates is just that previously it was like you just become a good academician, then a good clinician by practice, and then the higher ladder comes research. But I think right now you are all in a state where like academics, clinics, and research have to be seen simultaneously. So they are all interrelated. So it is very important that like we have to actually take research very seriously and resort to ethical ways of research is what is the most important request or advice I would actually suggest. Um, and resort to some newer ways of actually, even there was an article on like thesis, like how dissertation topics have become very redundant actually. So I think just resort to some ways of research. To just share one of our experience, one of my PG had published an app in for home-based intervention for children with autism spectrum disorder. Okay, so this is basically for from the institution side. That is, we have just moved on from like just cross-sectional studies and uh, retrospective studies, the all RCTs, all those things. So now just we have moved on to products, apps, and those things like in our institution. Just like to give a creativity to your research knowledge, I'm just sharing this. Okay. So thank you so much for all those students who contributed. I'm sure, like, of course, there were a lot of, I would like to admit that there were any research, we will have to keep improvising the study. There were few flaws in this study also. I would definitely agree with it. My last slide ends with how this study could have been made better. Okay. Because it's always better that like we learn from our own mistakes. It's not that like anybody who is presenting a study here means that like it's like all the study is very perfect. It's not like that. So like I will admit that there are a lot of flaws in this study. I'm glad that like students are able to actually pick up. So before I start this topic, I just wanted to say that of course like CASP is one thing. There's something called stroke checklist. I'm sure like everybody will be knowing. Consort guidelines and stroke checklist. Consort is for RCTs and stroke checklist you have for case control studies as well as for cross-sectional studies. That stroke checklist is available. You can actually go through that also for reasons of interest. So like as the topic is on regression, I'm sure like many students might be in your just a second year, you might not have started child psychiatry posting also. Yeah. So it is better to know that like autism spectrum prevalence is becoming very, very high. So that at least the take-home point of today's topic should have been at least that like early diagnosis of autism is the rule. Okay. The earlier the diagnosis, better, at least early the intervention, at least the better the prognosis should be the norm. So do not delay any intervention. Like if a child is diagnosed or even suspected or screened to be positive for autism, do not delay. From a professional side, do not delay. So regression is basically considered as loss of skills between 15 and 20. So the mean age, if you to look at all the studies, it is around like, if you see like even now, like 24 months, they're just saying around 2 years or 18 months to 2 years. So this is a very, very crucial period. That's why MenChat is for screening at less than 2 years or 18 months. Okay. So this is a very, very crucial period. So now there is one more suggestion that is generally given is ideally, every child, whenever they are going and meeting a pediatrician or a child specialist or a developmental pediatrician, they should have a record of developmental trajectory. So this is called developmental trajectory, which should be recorded by everybody. Okay, it is not like only when the child has a problem. So because the child might be normally developing, but the child might suddenly lose skills, which unless otherwise you also have a record, it might be very difficult to collect data for research. So for data for research comes from your own clinic. It's not that private practitioners or clinic people should not be conducting research. So actually, I ultimately just have some documentation of data. Okay. So basically, it is that here we are talking about not regression of just social skills, language skills, which most of the studies have focused. But like again, like there might be fine motor skills delay, and there might be delay in other skills also. So like bladder and bowel incontinence happens in childhood as a creative disorder, but like here we have just skipped about all other skills. Predominantly, regression is focused in autism on language and social skills. Okay. So many definitions are there. One of the definition for language regression is complete loss of expressive language skills after acquiring at least 5 words and using. Most of the studies have used this criteria stating that a skill, if it is lost, means it should have been present at least for a period of 3 months and then lost. The lost period should be also at least for 1 month to 3 months. That is what is the average range they say. So then only we can call that skill persisted and then it was lost. So that is what is you should just remember. And for language, at least like 5 words. If after acquiring 5 words, they should have lost. Okay. Why is this important? It is very, very important because it's one of the predictor for severity. Like it will just tell us like whether this autistic condition is it's going to be a little severe. It can be an early warning sign to just like say the progress, how this child is going to actually progress, or what all skills that the child is going to gain, and even after intervention, and how intensive your therapeutic intervention has to be in this child. This is what is going to actually, you are going to learn this based on this regression. And we are also thinking whether it is a different subtype of ASD that we are actually looking at. So whether a regressive type is ultimately entirely different, where it has to be detailedly evaluated or a genetic studies have to be conducted elaborately on this subgroup of population, which will throw more light on this. Of course, it is also linked to the prognosis. There are various forms of regression, and most commonly what was mentioned, I have already, it's mentioned in the study itself. So there are, we have divided into 4 actually, but ideally all the studies have looked at only 3 patterns. One is early onset pattern. Early onset means delay from childhood. Okay, delay from birth. Regressive pattern where the child was having some skills and then lost the previously acquired skills. So it might be very dramatic. Sometimes when it is dramatic only, you can always actually find out there is a preceding life event. It's not like slow loss. It is very difficult to say slow loss of skills, previously acquired skill. But if it is dramatic, then the family members will be able to easily identify, like how we remember like lunar cycles and like association with like mood disorders. Like there is exacerbation only during Amavasya, Paurnami, like that people are easily able to say. But there might be subtle episodes even otherwise also, which people miss out. Similarly, only this regressive episodes are actually subtle loss of skills, people might miss out. But if it is a dramatic loss, people will remember. Parents will also remember. There is another thing called developmental plateau phase, which we are not concerned right now, like, but because it doesn't fall under the purview of regression. So many studies have actually the problem with this particular phenomena was there are a lot of actually studies which have looked at both retrospective, what are the flaws, what are the prospective flaws. Most of the studies which have looked at retrospectively based on the parent reports, which is available, in spite of actually supplementing with home-based videos, there is no standardized measure on like how to comment on what is this regressive phenomena or regressive behavior. There is, as said, like the criteria used for regression itself is a big question. And when you use broad definition like us, like we might get a very high prevalence, which might be actually making a wrong impression of like overstating that like, okay, many children with autism will have regression. But when you use a narrow, a stricter definition, again, like I think like the definitions are very, very important to actually. This is again, we are not able to come to a consensus as far as regression is concerned. That's why it's still an area of research. Like if you just look at the prevalence rate is like if you just look on an average, it is around 30%, which is what is like many studies have quoted. So maximum like ours is saying, but like at least like if you just say 10 to 30% and almost like 30% is like what is the prevalence in many states. Risk factors, if you look at like there is a constant association. These are all based on associations only. These are all based on associations and various studies. They have found that like there are associations, causal association with like epilepsy, like how we just like found out just the preceding event. They have found out association with like, I mean, there is a strong familial history. So familial history of neuropsychiatric, neurodevelopmental illness, if it is there, then they have found that as a risk factor or a temporal correlation or a strong association factor. Children with comorbid autoimmune conditions like predisposed to any kind of allergies in childhood predominantly or develop allergic dermatitis, dermatological condition, they are at high risk for regression is other association. These are all based on studies. Comorbid intellectual disability, again, severity will also highlight, throw light on the regressive phenomena. And this is again, children, they have found that like between 15 to 18 months, when they looked at the brain volume and the head circumference growth, they found that regressive group had an increase in the brain volume and megalencephaly was actually identified. That was one of the retrospective factor that was identified as a risk. So all these are possible risk factors, but again, like requires a lot of studies to actually prove, because not many studies have looked at comparison of regressive and non-regressive group. Regressive and non-regressive groups comparisons have not found many associations. A lot of etiological hypotheses. Why do children with autism develop regression? The hypothesis, these are all environmental toxins exposure. There is something called as, which is one model which has been consistently talked about, is over pruning. So the pruning is a phenomena for strengthening of our synaptic connections. And over pruning happens much early in children with autism, which means that like the long-standing connections get deranged. So this is one of the reasons why they lose the skills over time. Okay. And the neuroinflammatory process is another hypothesis. These are all just proposed models and hypotheses for why do children with autism. Again, like can present differently in different age groups. One is in children, it is always like loss of language skills, like such as no longer using words they previously spoke. This they will be easily able to identify. Even in many of the studies, they were finding very difficult to identify social skills regression rather than language skills regression. So because parents were finding it very difficult to identify social skills regression. Maybe like it is reduced social engagement, such as avoiding, if it is something gross like this, avoiding eye contact, which might be a sign of autism itself, symptom of autism itself. But when do you say like the child was actually making eye contact? But what is easily parents would say is responding to name call. He used to respond to name call, but suddenly he stopped responding to name call. He used to point fingers, but he stopped pointing fingers. So these are all things that they will be able to identify in terms of reduced social engagement. Or increase in repetitive behaviors, sudden increase in repetitive behaviors, which is like not there at all, or like which was not there and suddenly there is an increase, which might be actually signifying that the regressive of skills is going to start. A return to earlier developmental stage, like leading. So even a self-help skills regression is like also not studied much. So that is what, like when it comes to autism, again, self-help skills again like goes into the domain of like intellectual capability, ability, or adaptive function skills. Okay. So like when it comes to autism, if you have to look at all the domains of regression, you will have to take social skills, language skills, fine motor skills, and then self-help skills. Regression in adults. Do adults experience regression? So they call it as autistic burnout. Okay, so we don't call it as regression. So sometimes what can happen is increased sensory sensitivity leading to avoidance of crowded and noisy environment. So they might have been exposed to comfortable environment, but suddenly they might actually develop increase in sensory sensitivity, which might lead to complete avoidance of all the external environment. Or they might withdraw from social interaction when feeling overwhelmed or difficult with tasks they previously managed well, or emotional exhaustion and increased anxiety. So these might be subtle signs of actually autistic burnout or in adults and adolescents. Adolescents and adult population, it is a very, very difficult and challenging. So it might be very difficult to comment on those. So does the regressive and non-regressive group differ? Definitely, based on the studies, they have identified that like core symptom severity of autism. So severity of autism can be actually different in regressive and non-regressive group. The pattern of regression actually might actually vary between the in the regressive group. Definitely, you can actually identify the pattern of regression, like how we told pure delay to pure regression. And what all the developmental areas and behavioral issues that can actually vary. So even in terms of developmental quotients, adaptive functionings, behavioral issues, there might be changes in regressive and non-regressive group. Again, lot of studies are required to reinforce these findings. Again, this intellectual capability. So now to just come to the last slide, how to take this study better or make this study better. If we have to form a protocol or proposal and with the same research idea or take it from the limitations of where we left, I think like one of the suggestion is like a prospective design is one study like design. Then the problem with this study sample size was also a major issue. So definitely we'll have to actually calculate sample size based on the prevalence estimates that is available for the phenomena of regression. Data from developmental trajectory, again, we don't have such data. I think it is mandatory that like every CDC or like every child development center should have a data where it will be easy to actually retrospectively collect it. All these are going to be added information to the parental reports, which is going to be substantiating your or validating your actually research findings. Use of home videos as confirmation for presence of intact skills. This many studies on retrospective parental reports have tried this. Okay, but again, the problem with this regression or loss of skills is also sometimes we do not know whether the lost skill is actually a permanent phenomena or whether the child will just pick up after that. For that only, long-standing follow-up is very, very required in such phenomena. So that is why individual developmental trajectory is what is suggested in many of the future research implications for these kinds of studies. Follow-up of long duration to see the pattern of regression. Standardized measures to assess regressive behaviors. There are regression validated instruments, regression data records, which have been used in like a few studies to ensure that the phenomena of regressive behavior is captured appropriately in all dimensions. Otherwise, what happens is like the time of regression, what is the skill of regression is what is actually asked. So where we might miss out on very crucial information about actually whether it is a lost skill or is it a phase of slowed development of the child to just like as a phase of normative phase where the child is slowing down and then like probably the child will actually slowly pick up on the skill with intervention. So use of standardized measures to confirm diagnosis of autism. Here we have just taken DSM-5 clinical criteria for diagnosis of autism. Again, you must be all knowing, I think people who are yet to go should know that like autism diagnostic interview, revised autism diagnostic observation schedule is available for diagnosis of autism. So ADOS is translated in Hindi and it's also available in Bengali. So compare regressive and non-regressive groups in terms of various domains. Whatever domains we can actually compare, we have just compared very less on this. We didn't make a non-regressive group. Like we just looked at like the pure delay group, developmental pattern, and all those things. So like we can actually expand to the clinical comparison in terms of various other domains also. So of course, like genetic studies are the future for these kinds of things because there are a lot of studies which have looked at like siblings with autism, like whether do they actually differ in the phenomenon of regression, whether when one child actually develops regression, how come the other sibling is not having regression based on monozygotic or dizygotic twin studies. Okay, so this classification of regressed skills is also one thing. Again, like whether it is social, whether it is language, or it is a mixture of everything. Again, even in the events, right, like preceding events, it's not like one event, life event that exclusively happens. Again, there might be a lot of recall bias. Ideally, it might be a conglomeration of both medical and psychological events. It's not just like one time, like just stress in family or any life event in family happens. So there might be a category where like there will be a mixture of events that can be actually precluding this regressive phenomenon, or it's just an association, temporal association. So with this, I just would like to actually conclude for the day. And thank you so much for the patient listening.
Thank you, sir. Thank you for the wonderful presentation. Any questions from the audience? Any questions? Okay. Sir, I have two questions, sir.
Yeah.
Sir, regarding is there any neurobiological basis for this developmental regression in autism? Is there any finding specifically given neurobiological basis for this regression?
Yes, sir. There are etiological models and hypotheses that are proposed. But again, they're all, when we actually look at, like, since there are not much of proper data available to look at like possible risk factors, possible association. Right now, what is the only information that is available is the genetic predisposition or the familial risk of neurodevelopmental disorder. So based on that only, they have proposed few hypotheses. One of the hypotheses is what is this, the over pruning of synaptic connections. Otherwise, it's all again like under evolution.
Okay, sir. The next question was, so we have talked so much about regression in autism spectrum, sir. But the current classification system has, I think, is not added this salient finding in their list of symptoms. In what way this that it impacts the treatment plan? So apart from early initiation of treatment, is there any special additional treatment that may require for cases of regression?
The therapeutic intervention, as it is said, like any therapeutic intervention for autism, once it is diagnosed, it has to be very intensive. The problem with like regression, as it is said, like the age at diagnosis, age at actually suspicion of autism, diagnosis of autism, still there is a huge gap. So if that itself is, there is a huge gap, then like probably some of the skills parents might be of the misconception that like, okay, the child will actually pick up later. So that is why the regression phenomenon is very, very important in terms of like diagnosis. So like if at all we are actually, the parents have identified that like a child who has actually been speaking few words, the child might pick up later. If that is a thought process, at least it's better to get it evaluated. So that intervention could start much earlier at the loss of a previously acquired skill itself. So that is the point, rather than like not much of changes, because once the skill is lost, it's almost like the severity of autism, the child is growing up on the gradient.
Okay. Okay.
So the therapeutic intervention will be much more intensive, and the hours will be actually at least like what they say is 20 hours per week, and it should be more.
Okay, sir. Thank you.
Yeah.
Any other questions from the audience? Then we can end up the today's session. And thank you, sir. Thank you, sir. So we can conclude today's session. Actually, for this session, we are proud to invite the guest from the Tamil Nadu. The idea mainly is to recognize and highlight the remarkable contribution from the Tamil Nadu-based researchers. As I hope this session was very useful for all. And now we'll move on to the vote of thanks. On behalf of RCBC, the IPS Tamil Nadu chapter, I extend heartfelt thanks to our guest speaker, Dr. Raman sir, and the presenter, Dr. Sibiarasan from GMKMC Salem. And special thanks to all the postgraduates, faculties, and state members and other organizing team for making this event successful. And thanks for the East West Pharma for the technical support. Let's continue to engage, learn, and grow together through this academic platform. And thank you once all again. See you in the next session. Thank you all.
Thank you so much. All the best for
Thank you.
these.
Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you, Dr. Shivan, sir.